All right, capillary collection. So capillary collection is preferred in certain situations and for different types of patients as well. So although the venipuncture is the most common way to obtain a blood sample, sometimes it's impossible or not advisable to do so. So capillary collection is the preferred method for obtaining blood from newborns and infants for neonatal bilirubin, newborn screening, and for point-of-care testing. Capillary collection is also used for ancillary blood glucose testing that they lots of times nursing will perform on the floor. So adult patients undergoing frequent glucose monitoring are excellent candidates for capillary collection because the test requires only a small amount of blood, which must be taken frequently. So you can assess the venipuncture sites. They may be difficult with obese patients whose veins are often hard to find, and with geriatric patients who often have small and fragile veins that can make obtaining venous blood difficult. So sometimes that's when a capillary collection will come into play. Reasons for performing capillary collection continued is venipuncture may be contraindicated for patients with burns or scars over venipuncture sites, or for those at risk with venous thrombosis, like a blood clot, because venipuncture increases the risk of venous thrombosis. Other patients may be at risk for serious complications associated with deep venipuncture, including iodotropic anemia, hemorrhage, infection, organ or tissue damage, arterial spasm, and cardiac arrest. Another reasons we could be doing capillary collection is capillary collection is usually a preferred method, as mentioned, for newborns, infants, and children younger than 2 years of age. Young children have small veins and lower blood volume, which make venipuncture difficult and potentially dangerous for them. However, some tests cannot be performed on blood from a capillary collection, so we would need to still do a venipuncture on these patients. The types of blood that would not be able to be used on a capillary example would be a blood culture, and a lot of the coagulation tests that we collect in that light blue tube could also not be done by a capillary collection. So back to the newborns. So reducing blood volume through venipuncture is a concern for newborns and infants. It may lead to anemia and even cardiac arrest and death. Capillary collection may not be appropriate for severely dehydrated patients because test results may not be accurate. So this could also be a concern with venipuncture on these dehydrated patients as well. So differences between venous and capillary blood. A capillary puncture collects blood from the capillaries, generally in the finger or heel for newborns. The arterial proportion in the sample is increased when the collection site is warmed, as may be done to help increase blood flow before collection. If a patient needs repeated determinations of potassium, calcium, total protein, hemoglobin, or glucose, you need to make sure that you're doing the same collection technique each time. And that's because it could be different if you're doing a venipuncture one time and then a capillary blood draw the next time, because it may be venous versus a higher arterial blood concentration. So because capillaries are the bridges between arteries and veins, blood collected by capillary puncture is a mixture of venous blood and arterial blood. Small amounts of tissue fluid from the puncture site may also be in the sample, especially in that first drop. Skin puncture devices. So they have an automatic puncture device that will deliver a quick puncture to the site at a predetermined depth, so it doesn't go too deep. Which can be a significant advantage at site where the bone is close to the skin. So skin puncture devices in the modern healthcare environment are designed with a retractable blade per OSHA safety regulations. Some devices are contact activated, whereas others require the phlebotomist to depress a trigger to release the blade. So depending on your facility, you'll either be using one or the other or both. So the picture on the left bottom is actually one of those that you push into the skin. So that is one of those contact activated ones versus the ones on the bottom right where it has a little button on the top that you press that button and then it's a trigger that releases the blade to go into the patient's skin. We can use micro sample containers for capillary collection. Microtainer tubes are also sometimes called bullet tubes and can hold up to 750 microliters of blood. The tubes are color-coded by additive to match the coding of evacuated containers. So if you have a light green microtainer tube, you would have, it matches the same additive as the big light green tube. Micro collection tubes are made of plastic and are available with a variety of those anticoagulants and additives. Capillary tubes are available in plastic and come in a range of sizes, and they're available in different colors as well. The microhematocrit tubes are small plastic tubes with a volume up to 75, and those are used pretty infrequently. Additional supplies, sometimes we would need a warming device, which helps increase that circulation to the area, which would help get a better blood flow once that site is punctured. There are commercial warming packs available, such as the one shown in the picture there on the slide. The temperature of the device should not exceed 42 degrees Celsius, and it should be applied for about 3 to 5 minutes. Site selection, so general considerations, the capillary collection should be performed on warm, healthy skin that is free of scars, cuts, bruises, and rashes. Bone puncture, if you choose the wrong site and get too close to a bone, could lead to osteochondritis, which is a painful inflammation of the bone or cartilage, or osteomyelitis, which is a potentially serious, sometimes fatal bone infection. So you should also avoid skin that has been damaged or compromised in any way. So as mentioned, if there's scars, cuts, or anything like that. Specific areas to avoid include skin that is calloused, scarred, burned, infected, bruised, has any types of swelling, or is bluish in tone. Also avoid previous puncture sites if possible, as well as sites where circulation or lymphatic drainage is compromised. The puncture depth and width, so to minimize the risk of inflammation and infection, the lancet should never penetrate more than 3 micrometers deep. For a heel puncture, the maximum depth is 2, because the calcaneus or heel bone can lie very close to the surface of a baby. The puncture width should not exceed 2.4. Capillary collection sites for adults or older children. So the best site for those are actually on the palmar surface of the distal segments of the third or fourth, so the middle or ring finger. And as you see on the picture there, it's kind of on the sides as well, because it's going to be the farthest away from that bone. For babies, you're going to do a dermal puncture, and that's usually performed in the heel, as shown in the picture there. It's once again kind of on like the finger. It's going to be along the sides of the heel. For younger children, less than 1 year, there is too little tissue in the finger, so that is actually why we perform it in the heel. Steps for capillary collection is pretty similar to the venipuncture. You're going to document the requisition, sanitize your hands, and put on gloves. You're going to assemble that equipment that you need, and you're going to clean the site and select it. You're going to position and hold the area, and then you're going to make that puncture. You're going to dispose of that blade properly. You're going to prepare to collect the sample, and then collect that sample into the appropriate tube, and then you're going to complete the procedure. After documenting on the requisition that you are performing a capillary collection, make sure that you are sanitizing your hands and you put on gloves. You're going to assemble your equipment and select and clean the site. So sometimes you may need to warm that area, especially if the patient is warm, or if you're giving it a little bit of a squeeze and you're not getting much redness. Sometimes you need to warm that area. You're going to use 70% isopropyl alcohol to clean the area. You're going to position and hold the area. So you're going to hold the finger or heel firmly. So you're going to grasp that patient's finger with its palmar surface up, holding it between your thumb and index finger. And for the heel, you're going to place your thumb in the arch and then wrap your hand over the top of the foot and place your index finger behind the heel. You're going to puncture that skin slightly lateral to the center of the finger, and then you're going to dispose of that blade. You're going to line the device so that the cut is made across the fingerprint ridges or heel lines, and then dispose of the used blade immediately in an appropriate collection container. So even though the blade may be contained within that device, we still don't want a used needle hanging out where somebody could potentially access it. Then you're going to prepare to collect the samples. You're going to wipe away the first drop of blood with a clean gauze pad, and that helps to prevent contaminating that sample with that tissue fluid. So you're going to keep the finger in a downward position to help encourage blood flow. And then you're going to collect the sample. So once the blood is flowing freely, you're going to position the container for the collection. You can alternate applying and releasing firm pressure proximal to the site to increase flow, but you're going to avoid constant massaging because that could actually cut off the flow. It could also cause hemolysis, and it could introduce tissue fluid back into the sample. Precautions to observe when collecting capillary blood. So microcontainer tubes should be slanted downward. You're going to tap the container lightly to move the blood to the bottom because it's going to be drip by drip. And then you're going to be careful not to overfill the micro collection tube that's containing that anticoagulant. Order of draw and collecting capillary blood. So you will do platelet counts, CBCs, and other hematology tests first, and then chemistry tests. So you're going to do that lavender tube first and then the green top tubes. You also need to be mindful of specimens that require special handling before transport, if they need to be, protected from light or frozen or refrigerated, things like that. To complete the procedure, you're going to apply the pressure to the puncture site using a clean gauze square. Once the bleeding has stopped, you can bandage the site for older children and adults. If it is a younger children, usually 2 or younger, and it's on their hand, we're usually not going to put a bandage or anything on there because kids like to put everything in their mouth and they could potentially choke. So lots of times we'll just kind of sit there and hold it until it's done bleeding, and then they're free to go. You're going to make sure you label that micro sample container before the patient leaves, and you're going to place it in a larger holder for transport to the laboratory. And as always, make sure you thank the patient.